Hello, this is Deb Delvecchio Scully, a special consultant for Professionals United for Parkland. And in this presentation, we're going to discuss suicide prevention and what words to use, the warning signs, and how you can talk to each other about this. I'd like to review with you some of the confusing myths that are often repeated around suicide. First and foremost, talking about suicide is not going to increase the risk that someone will try it. It might actually decrease it. Recognizing that for a teen or anyone else who talks about suicide is not looking for attention. They are looking for help, and that is a cry for help, and we need to take that seriously. If someone attempts suicide and are unsuccessful, it doesn't mean they weren't serious. It just means they were unsuccessful. And the likelihood that they might try again is quite strong. A big confusing point is that people think that prior to someone trying to hurt themselves or actually die by suicide is that they act sad before. That could happen, but it's also quite possible that someone would feel a sense of relief, even elation, once they make a decision where they feel will end their pain or the pain that they believe in a very distorted way that they are causing other people. Often there isn't a lot of time spent in planning it. It is a very impulsive act, quite often. And understanding it's a permanent solution to a temporary problem. If someone tells you they have a plan, take them seriously. They mean it, and they really need your help and support. And the final thing is that teen suicide death is rare. That is not true at all. Take it seriously. Act. Tell a friend, tell a parent, tell a teacher, tell a coach, tell a helper who can help you manage the situation if someone's disclosed this to you or if you're feeling this way yourself. Some of the signs that can tell us that someone might be thinking about it is if someone tells you or they write about or they post on social media an indication that they wish they were dead. You become aware that someone is planning for a suicide. Some behaviors would be actually writing a suicide note, saying goodbye, giving away their prized possessions when there's no other reason to explain why they might be doing that. Having an extreme focus or preoccupation with death. Looking for major changes in behaviors and habits. And that could be in personal hygiene, that they either stop eating or they eat more, or their sleep is disrupted. They become more and more isolated, or there's conflict. So it can be a sudden change in friend groups. So friend groups that they've had for a while suddenly are no longer friends with, and they have new friends. Or actually the result of bullying of some sort. Academically, educationally, it can be grades are changing, not attending class, getting into conflict with teachers, you're not doing homework, not submitting your assignments in the way that someone you always would have done. And mood changes, that can be that unexplained happiness that I mentioned, or mood swings where you feel like you're up and down, or you notice someone else. Just these up and down changes. And it can be a worsening depression or extreme negativity. And we also see an increase in risky behaviors. So that can be an increased use of alcohol or of drugs, self-destructive behaviors, excessive shopping, excessive perhaps even gambling, just really driving erratically or really fast. Um, and there's a hopelessness. Generally, you may feel or someone else may feel that there's no way out of the situation, but there always is. Additionally, there can be an increase, just withdrawal from family, your connections to relationships, family, friends, uh, regular activities. It could be, for example, let's say you love to play baseball and you decided not to go out for the team, which might be fine, but also might be a sign of a worsening depression. Um, I think a big one is an increase in physical symptoms. So that can be stomach aches, headaches, feeling really tired, um, just an overall what we call malaise, where you just don't feel like doing anything, being very unmotivated. You can't get yourself started. Uh, and it's hard for you to take in, and you might actually reject any positive statements, praise, or rewards that are directed towards. Some of the things that increase the risk might be having a pre-existing issue. It might have been something like anxiety or heightened stress or depression. Um, if there's sudden conflict in your family or there's some other problems in your family unit. If you've developed some kind of a problem with drugs or alcohol that maybe no one knows, perhaps you're drinking secretly or really needing to use marijuana in order to get through your day. There could be physical issues, medical issues related to these risky behaviors. For example, someone becomes pregnant or they realize that they contracted a sexually transmitted infection as a result of these risky behaviors. Being the victim of bullying. Um, A big one is if you're uncertain about your sexual orientation. Maybe you haven't talked to anyone about it. Maybe you're questioning it. Maybe you're just not sure. But that can add extreme pressure or stress to whatever situation you're in. If someone you know, and we know that this has just happened in this community, where there are suicides of classmates, friends, that can make everyone at a heightened risk. Now, just because these are risk factors, it doesn't mean that you will do that or follow through with it. It could just mean you have to pay better attention to how you're feeling, how others around you are feeling, and really adopt some of the healthy coping strategies. If you think that any of the things I've said to apply to you, or if they apply to your child, or they apply to someone you know, you've got to ask them directly. Empower yourself to be brave and courageous to say the words. Are you thinking of hurting yourself? Are you thinking of suicide? Take any threat. And sometimes people will have passive suicide thoughts, and they might say something like oh, you would just be better off without me. And they might laugh when they say that. That's what we call a passive suicide thought. That still needs to be paid attention to. Reach out. Reach out to someone that can help you. Call 211 if you don't feel like you have somebody in your life. They have confidential counselors who will speak to you by phone and help you sort through whatever you need. Uh, Parents and kids, this is for both of you. Parents, you need to actively enforce a treatment plan. It's not a question of whether or not you or your child is going to go to therapy. It's a question of what are the preferences around that? Would you prefer a male therapist or a female therapist? Would you prefer that I go with you to therapy? Would you prefer someone else goes with you to therapy? Reinforce them of your love and concern for them. That's really, really important. Again, parents and kids. It's everyone's responsible to secure the home and make it physically safe. And so that's eliminating access to prescription medication, what we call lethal means. Firearms need to be safely stored or remove them altogether. Securing knives, other weapons, rope, cleaning chemicals. Um, there's a contract that has to happen between parents and teens where the parents' responsibility is to try to help keep these kids safe. Empower yourself to check their bedrooms, their vehicles for weapons, illicit drugs, alcohol, or any other substance or means that they can use to harm themselves. Finally, it is everyone's responsibility to help everyone feel the best that they possibly can. And that can feel like a burden. And I appreciate that. And that's why I really encourage you to reach out to someone that you trust. If that's a parent, if that's a teacher, a coach, a therapist, someone whom you can talk about maybe how you're feeling or what you're hearing from someone else. One thing that I think is really important to remember, and that is you will not regret taking action to help keep one safe, but you may regret the result of not taking that action. Just a reminder of ways to reach help in the moment. Contact a family member, a loved one. Call 211 where they have confidential counselors. Call 911 if you have to. And know that all of these people answering on the other line are trained, specifically trained to help you and to help anyone else that you might be concerned with. You can find additional resources on the Professional United for Parkland's website and on their social media pages.